Dr. Jean Rodriguez here at Lee Wellness. Today we're going to do some needling of McKenna. She was giving us a little brief rundown of her injuries, and she had a tear of the right multifidus, right?
Yes.
Back when she was a little younger. We're not going to go in details, but back when she was younger. So she's dealing with some right paraspinal multifidi tightness. In McKenna's own brain words, it was described as somebody took a rubber band, stretched it, froze it, and then put it back there. So we'll see if we can first defrost and then see if we can release some of that. Almost look like your scoliosis, right?
Like the hypertrophy compared to the atrophy of the other side is crazy.
So here we're gonna combine dry needling, yeah, but mostly acupuncture to get a response here and there. Around the T7 where the scapula is, right around there. Because if we poke there, she'll tell you that doesn't feel great. And here as well. Just along the spine, and then here we go more to that paraspinal multifidal muscle. You can see my fingerprints or finger marks. One of the questions I often get is, does it hurt? Because sometimes it can be a little tender, so sometimes depending on inflammation, right, that area can be a little more than tender. It feels kind of like pinchy or pokey. So we'll see. How does that feel?
Good.
And here is safe. I know people talk about, or people are afraid of a pneumothorax or anything related to a lung field, but this is the spinous process right here. McKenna can confirm I'm in the spinous process. If you go, the spinous has a TP or transverse process. As long as you stay within that range, the needles are not going to go past the bone. I like to go here, top and bottom, right? The spine is like, not like, it is a tower, right? So you want to get some response through the top and bottom and communicate through. And then we go to that QL muscle.
Does this one go deeper?
No, I'm still going to keep it same length. You meant needle or deeper meaning?
Yeah, like deeper needle.
Well, I'm using 1 and 2 inches. So a little bit deeper, but not by a lot. By an inch to be exact. And here I'm going to go a little bit lower, more to that top of the glute, because that's more where that tissue lays, just because of the anatomy and the curvature of our spine and sacrum. Sometimes this one right here gets a little tender just because of the area. This is one question we get a lot. But before we get to that, watch this. So this is the cool part, right? So you see how you see the redness there, redness there, redness there, redness there, and there too, right? What does that mean? A lot of people say that's a reaction, right? When we put needles, we're creating or drawing energy, right? We either tonify or sedating, so drawing that energy in that area. At least we can assume that's a reaction, right? Because you see it here, but there is nothing there, right? So again, a reaction from the body saying we're drawing a lot of energy from that area, or to keep it simple, there is something going there that is creating enough inflammation, right? Inflammation is part of the healing process. Inflammation is not always bad, it's just a reaction from the body, and that's what the body does, right? Let me know when you start feeling it here.
Should I feel it a lot or a little bit?
Just medium,
That's
nothing
good.
crazy. Another question I do get a lot is, what do the electrodes do? So the best way it was explained to me was the electrodes are communicating with the brain, creating that reciprocal approach and neuromuscular re-education, if you want to call it, right? Just to communicate and say, brain, this area needs some help. That's why after we take all of these out, people often say, oh, I still feel like I have it in me, right? Because it's that sensation, that reaction, while that communication is being established with the brain, saying, hey brain, we need help in this area. Let me know when you start feeling it here in the glute and lower back.
Yeah, that's good.
A little upper, but still kind of lower back. More of a multifidus.
That's good.
Good. We'll do that for about 6 to 8 minutes and we'll take him out. So here we have cross current in the middle of the back. So current going this way and current going this way, right? Just to create a little sensation in the middle. We don't want it on top, we don't want it at the bottom, but we have to adjust depending on how tight, how much tension the patient is dealing with, right? Same thing here. Sometimes this area right here gets a little aggravated. I'll say the bell line or going up in the lower back, just because you have the lumbosacral fascia here. So there's not much muscle, but the white stuff, tendon, ligaments, right underneath that, there's a bunch of ligaments on the sacrum and the pelvis. But on top, musculature wise, we have the lumbosacral fascia that normally tends to pull up. So if you have pain in this area, we can help you. Don't have to do only needles. We can do different modalities that we have in-house. McKenna takes a lot of pride getting all the gadgets and all this stuff for us, right? But ultimately for you guys, so we can help you guys get out of pain, but ultimately empower you and gain control of your health.
I feel like I need to shove a needle so deep into my back that it almost touches my spine. Because the multifidus is so deep.
Yeah.
I mean, it's true.
Yeah,
like,
no, hey. Some people are like that, right? Hey, and that's what you say here, we say a lot. It sounds cliche, but we gotta meet the patient where they are, right? Are we dealing with an elite athlete, or are we dealing with a retired athlete, right?
Hey,
right?
I can be both.
We have, you know what I mean? We have geriatric people here who have played D1 sport, professional sports, right? And again, we're not going to retire 50, 60, 70-year-old athlete compare with the elite high school level athlete. Like, you got to meet people where they are and then create a plan, progressive overload. Just like the gadgets we have to treat people and make them better, we have gadgets to train people and not guess. We have the data, right? You guys saw the video that we made, and we all make videos explaining what we do, how we do it, and why we do it, right? Ultimately, to provide a better avenue for you, whoever is watching this, right? For you to be able to gain control of your health. Like, as much as we know and as much as we wanted to, ultimately it comes down to you. You have to do it for yourself, okay? We're here to guide you. Coach, right? We're doctors, we have our titles, but we're life coach, training coach, right? We want you to get control of your health, just like a coach will want their athletes to perform to the best of their abilities. And I will say this too, right? All these are right here.
All tender.
Mm-hmm.
But like, so tender that I feel like I just want to jam needles like all over it.
Yeah.
I won't do that, of course, but I feel like I would like it.
You know that bulldozer meme? When you have back pain, you need like a bulldozer to run over your back.
It needs to like come from the inside though. Like, I wish someone, instead of something rubbing on the surface, I wish it could go deep inside the body and then like release it from within. That's kind of what it feels like.
But that's where understanding, right? Some people after like said, oh, I don't want needles or I don't want adjustment or whatnot, right? And you have to adjust and right, what am I gonna do if all I have is a hammer, right? I cannot use a screwdriver if I have a hammer, but what if I only have screws and not nails, right? So I gotta figure it out. And that is a great response right there, right? Again, some people say you hit a blood vessel and whatnot. I still find it hard to believe, and the research says as we draw that energy from it, if blood comes out, that's the amount of energy, right, that was drawn from it. However, the amount of blood we get is that, no more than that. So even though if we get a hematoma on the skin and the skin turns purple, black, yellow, green, whatnot, right? That's all the blood we get. And if you feel it, you can tell, right, McKenna? How does that feel?
Fine.
See? So again, and there's no blood. Blood is gone. So, but you can see the reaction that was left from that needle. You see that one too, but you see how that one is a little bit bigger? It's just that energy in that area, granted. Where is the multifidus, right? In that same area. So it is matching to what she's describing.
Maybe we need to drain more energy out of it.
Oh yeah, so that's what we're gonna do now, right? So now we're gonna do a little bit more of what is known as dry needling, right? So with dry needling, I will stay away from that area, but I'll grab this area right here and go like that. And I'm grabbing the skin and I'm just playing with the needle in the skin I grab. You feel that? Mm-hmm. That too much?
No.
I do feel the muscle twitching. So after we created that, a little bit of that reaction, right? Now I'm gonna use my fingers and see if I can help that muscle glide and basically relax and contract with movement. So she said it was all the way through here, and now we found it, right? Using my thumb right here, and I can feel.
Ooh, what was that?
Well, girl, I read the book. Right?
That was lumpy, whatever that was.
Your paraspinals, yeah. I mean, it is multifidus too, don't get me wrong, but paraspinals for sure. Like when you go through this, you see I'm in the paraspinals, and she can tell you it's lumpy. You can see lumpy too, and I got it right here again, right? And now if you wanted to, you can ask, all right, McKenna, just put your toes on the table, these toes,
Yes.
yep. And as I go down, just bring your knee up. Yep. And aha, bingo.
It makes it more pronounced
Mm-hmm.
because it flexes the muscle.
Yep.
I'm so smart.
Alright, let's do it again.
Okay.
Wow.
Oof.
Mm-hmm.
Like it feels so painful that it's so good.
And that's what I do. That's my job. It's painful. Guys, remember that? It's still painful, but it feels
Like it's
good.
so good. I can't explain it.
It hurts
Like
so
right-
good.
Yeah.
I get that a lot.
Like right there.
Bring it above your head now. Sorry, there's. Uh-huh. Yep. One more. Yes. Good. Relax. Let's do the leg again.
Okay.
Bring the leg up. Bring it up. And now you see how it's down here now?
Mm-hmm. You moved.
Well, it didn't move. We just work it up and down, and the muscle glides. Do it again. Let's see up here. It's still up here too.
Mm-hmm.
But you see how it doesn't jump like it did before?
Do you feel that when you get towards the bottom?
Yep. It's like butter on this.
Yeah, there's
down there a little bit.
There's nothing there. There's not even muscle there.
But you see like how everything is connected. So we can treat the low back and leave it alone, but right now we're looking with the shoulder, the leg, and we're getting responses from both sides in the same area, right? It shows you how everything is connected, upper and lower extremity.
Help me, doctor. No, but seriously, help me. What am I gonna do? Like it feels better, but I feel like you need to press
Yeah,
so
no,
hard,
I'm
like
gonna adjust
100
this.
times, and then maybe it will loosen itself.
Oh yeah, McKenna.
Almost like
That's why we're patient.
Almost like a hose that has water stuck in it, and you need to like force it out somehow.
Well, bring your arms to the
Except
side.
there's no opening to the hose, so we gotta like.
Well, hopefully it doesn't come from your opening side.
Oh, you just never know with me these days. You never know.
Exactly, I just want to make it clear. Let me adjust your upper back, mid back.
Okay.
The deep breath in. All the way up. Do you see how easy it was without it,
I really try to relax into that one.
Mm-hmm. Deep breath in, all the way up.
That one didn't want to move.
Bring your ear to the shoulder. Good. Let's see. Look up. Hello. Good. Go on up.
A little.
I don't think you want to hang.
To one
like,
side?
pull up. Like,
Yeah,
pull-
like
pull
I
up.
want you to spider monkey wrap around my legs and like yank them down as I hold a bar. Why are you laughing? I'm being serious.
Because no, I mean, that's a little aggressive, but yeah.
But that's like what I feel like. I need aggression. What? But that's the level of like tightness it feels.
Oh, I felt it. I
So
know.
what do I do?
Just, I mean, we can continue working.
Come back to it. See Dr. John Rodriguez at Elite Bonus 7 days a week.
No, in all honesty, it's not 7 days a week, but it will take time, right? These are things that will take time. I wish I had the magic power to eradicate it all at once, but it don't work like that. So normally we say 4 to 6 visits. You should see improvement between 3 and 4, but after that, it should get better. That's when we start spending. Ultimately, our goal is to get you back in the gym so you can train with our trainers, right? Because we take a lot of pride in educating everybody and make sure you're meeting up the standards that we create here at least. So come see us.